Hello everyone, I'm Rita. Welcome back to Medicine Nursing. So today we will be discussing one interesting and very important topic that you can see on screen, where a pregnant woman with a sad face is complaining something to a nursing officer that I don't know what is happening to me. I'm 3 months pregnant and yesterday I suddenly had severe pain in my lower abdomen. Then I started bleeding heavily. I even saw some tissue like mass coming out. I thought my baby is gone, but still bleeding is not stopping. And I'm very scared. Is my baby okay? So, this is the voice of a real mother in distress, right? She doesn't know the medical term for her conditions, but as you prepare for a competitive exam, you must identify it immediately. She is describing something related to abortion. You might be knowing the concept of abortions, or may not be knowing what is abortion, what are the types of abortion. So, today we are going to study abortion and its type in such a simple way that you will never forget, and you will also understand how to help a mother like her in her real life, as well as if examiner asks in question, how will you rectify what exact answer examiner is asking for. So let's begin this today's topic. So what is abortions? What is the definitions of these abortions? So according to World Health Organization, abortion is terminations of pregnancy. Okay, termination of pregnancy before 20 weeks. Before 20 weeks, or else we can say when the fetal weight, when fetal weight less than 500 grams, then we will say it is a case of abortion. So again I repeat, if termination of pregnancy occur before 20 weeks or fetal weight is less than 500 grams. So if it is less than 20 weeks, abortion pregnancy gets terminated, then only we will say abortions. Now if it is a case of more than 20 weeks, whether you will say it is a case of abortion? No, absolutely not. Then we will say it as preterm delivery. Okay, if I ask if a pregnancy ends at 14 weeks, whether you will say it abortion? Yes, absolutely, as it is before 20 weeks. If I say if a pregnancy ends at 30 weeks, will you say it is a case of abortion? No. It is a case of preterm delivery. So that's all about this abortion and its definition. Now coming to the types of abortion. If I classify this abortion, then I will say broadly we are classified this abortion into two types. Those are spontaneous. Spontaneous means what you are understanding, that something which is occurs naturally, and another one is induced. Induced means something which we are doing intentionally, right? So what is spontaneous abortion? The another name of this spontaneous abortion is miscarriage. Okay, so what is this spontaneous abortion? Spontaneous abortion means it occurs naturally. Okay, occurs naturally without any medical intervention. Without medical intervention. Okay, now what is induced abortion? Induced abortion means termination of pregnancy intentionally. Now intentionally you can terminate the pregnancy by giving drugs to mother. Okay, those drugs are, just remember, misoprostol and mifepristone. Okay, or by doing any surgical intervention, surgical evacuation. Now under the surgical evacuation we can do dilation curettage, or we can do suction evacuation. Suction evacuation. Okay, so this is broadly classified into spontaneous abortion and induced abortion. Now again we are classified this spontaneous abortion into 5 major types, and today our topic of discussions will be this spontaneous abortions. Now we are classifying again this spontaneous abortions into 5 major types. That is your 1, threatened abortion; 2nd, missed abortion; 3rd, inevitable abortion; 4th, incomplete abortion; 5th, your complete abortion. We will discuss one by one this all types of abortions. Now coming to this threatened abortions. Our first topic of discussions will be threatened abortion. What is the definitions of threatened abortion? So threatened abortion means vaginal bleeding. In this kind of abortion, vaginal bleeding occurs. Okay, vaginal bleeding occurs in early pregnancy, but cervix remains closed. Okay, cervix remains closed. And another one unique feature is that in this case fetus is alive, and that is very important and exclusive character you need to remember, that in case of threatened abortions, why I'm saying it is exclusive or unique feature, because it is the only type of abortions. I'm giving 5-star marks because this is the only abortion where fetus is alive. Remaining all abortion, fetus died. Here also fetus died, here also fetus died. So now just imagine, if fetus is alive, then pregnancy can be continued, right? So in this case, pregnancy can continue. But whether you continue this pregnancy in case of missed abortion, no, as already fetus died. Here also you can't continue. Here also you can't continue. And in this complete abortion also you can't continue. And because of this only, threatened abortions is a unique type of abortions where fetus is alive and pregnancy can continue. So just remember, what is the definitions of threatened abortion? The definition is that early pregnancy में vaginal bleeding होगी, लेकिन सर्विस बंद रहता है और फीटस जिंदा होता है. एज बिकॉज फीटस इज अलाइव, दैट्स वाई इस प्रेगनेंसी आगे चल सकती है. डू यू अंडरस्टैंड? नाउ कमिंग टू दिस की फीचर. व्हाट इज द की फीचर ऑफ ब्लीडिंग स्टेटस? नाउ ब्लीडिंग विल बी, इन दिस केस ऑफ थ्रेटेन्ड एबॉर्शन, mild spotting will be there. Okay, very less amount of bleeding will be there. What about the pain? This pain will be either absent or will be mild. Mother will complain, no, I don't have pain as such. Or if it is pain is present, mother will say very mild amount of pain will be there. Now if you do parvaginal examination for checking whether cervix is open or not, then you will see cervix remains closed. Okay, as cervix remains closed, then whether product of conception will come out? No, product of conception will be inside the uterus. If cervix will be open, then product of conception will come out. If cervix is closed, if it is closed, no product of conception will come out. Okay, that's the concept. In case of threatened abortion, cervix will remain closed, and that's why this product of conceptions won't come out. It will remain inside the uterus. What about the uterus size? As fetus is alive, then fetus will grow. In case of normal pregnancy, as fetus is growing, in case of threatened pregnancy also, fetus will be growing in such a way as fetus is alive. So if fetus is growing in normal way, then uterus size will be also increasing according to the gestational age. So uterus size will be equal to period of gestation. Okay, I think it's quite clear for you. What about the USG finding? If you do USG, then you will see fetus alive, right? If fetus is alive, then you can get this heartbeat also. Fetus heartbeat also will be present. So this is very important and unique feature. And from this feature, you can differentiate this kind of abortions from other abortions. So you have to remember this. Now pregnancy symptoms. If the mother came at first trimester, mother will still saying, no matter abortion happen or not, mother will be saying, yeah, I have nausea like how normal pregnant female is having. I am having vomiting. I am having this breast tenderness. I am having these leg cramps. Okay, I am having this lower backache. All kind of pregnancy symptoms will be present in these cases. So that's all about this threatened abortion. So what is the definitions of threatened abortion? That early pregnancy में vaginal bleeding होती है, but cervix close रहती है in this case, and fetus जिंदा होती है. As fetus is still remain alive, दैट्स वाई इस प्रेगनेंसी आगे चल सकती है. प्रेगनेंसी कैन कंटिन्यू. ओके, मदर कैन कंटिन्यू दिस प्रेगनेंसी. नाउ व्हाट आर द की फीचर्स? ब्लीडिंग विल बी माइल्ड. Mild spotting will be there. Pain will be either absent or less amount. Mild pain will be there. What about this cervix? If you do pervaginal examinations, you will see cervix remain closed. As cervix remain closed, product of conception won't come out. So it will still remain inside the uterus. And uterus size will be equal to period of gestation. Why? Because fetus is normally growing as fetus is alive. Now, if a threatened abortion case will be coming to you, like a mother with threatened abortion come to you, what kind of complaints she will give to you? She will say like, मुझे थोड़ा थोड़ा ब्लीडिंग हो रहा है, कभी कभी हल्का पेट में दर्द होता है, और ऐसा like still I can feel the baby's movement. Okay, this kind of complaint mother will give you. मुझे थोड़ा थोड़ा ब्लीडिंग हो रहा है, कभी कभी हल्का पेट में दर्द होता है, and I can still feel the baby's movement. This kind of complaint mother will give to you. So now what is the management of these threatened abortions? So you will reassure the mother that everything is okay. Reassure mother. You will advise mother to take bed rest. Okay, you will tell mother to avoid intercourse. For how long? You will tell mother to avoid intercourse up to 2 weeks. Okay, you will tell the mother to do regular follow-up. Okay, then you will tell mother that do USG after 3 weeks. For what? For checking baby fetal status, whether baby is still growing, what is the growth rate, etc. You will check from here. So that's all about this threatened abortion. Now coming to the missed abortions. Now student, please be attentive, because here I will be telling you how will you differentiate this threatened abortion and missed abortions. Okay, now what is the definitions of these missed abortions? So the definition is, what color I will choose? Let's choose this one. Okay, so the definitions of missed abortion is that fetus dies inside uterus before 20 weeks but is retained for weeks without expulsions. Can you understand? Here the previous abortion cases, you see that fetus still alive, but here fetus died, and that's the thing will differentiate between missed abortions and threatened abortion. Here this fetus died inside the uterus before 20 weeks and mother is not aware of that. Why? Because fetus is retained inside the uterus without expulsion, and that is why mother is not aware of that. What mother will understand? Mother will say ki, why suddenly baby's movement stopped? Why my nausea, vomiting, leg cramps, breast tenderness suddenly stopped and I am feeling okay like in my non-pregnant stage? Like this complaint mother will give you. We will come one by one. Now we come to this definitions again. So what is the definitions of missed abortions? फीटस यूटेरस के अंदर मर जाता है लेकिन कई हफ्तों तक बाहर नहीं निकलता है. दैट्स द डेफिनेशंस ऑफ दिस मिस्ड अबॉर्शंस. नाउ कमिंग टू द की फीचर अबाउट दिस ब्लीडिंग. In this missed abortions also, bleeding will be either absent, or if as fetus is still remain inside the uterus for few weeks, there will be brown discharge. Brown discharge in later after few weeks. Okay, sorry, brown discharge after few weeks. So this is the status of this bleeding. Bleeding will be absent but brown discharge will be there. What about the pain? Pain will be here also, pain will be absent. Okay. What about this parvaginal examination about this cervix? Here also cervix remain closed. Okay. As this cervix is remain closed, that's why here also in this case no product of conception will come out. It will be inside the uterus. That's also the same feature as missed abortions. Now, the similar feature you get from missed abortion and threatened abortion is that in both cases, bleeding will be absent or very mild, pain also absent, vaginal examination in both cases, cervix remain closed, and this product of conception in both cases won't come out, it will be inside the uterus. Okay, what about the uterus size? Now, this is different from this threatened abortion. In case of threatened abortions, what was happening as fetus was alive, that is why uterus also growing normally and the uterus size was period of gestation. But here what happened, fetus died, right? Now there is no further growth of this fetus. As there is no further growth of the fetus, there will be no growth of the uterus. Uterus growth will stop here, and that's why uterus size will be smaller than gestation. Okay, so here it was equal to period of gestation, but here it is smaller than your gestation, as because fetus died. It is differentiating feature. What about the USG finding? As fetus died, then will you get heartbeat? No, there will be absent of heartbeat. Okay, absent of heartbeat. If fetus died, whether those minor ailments will be present like nausea, vomiting, leg cramps, breast tenderness? No, it won't be present. Mother will say suddenly nausea, vomiting, leg cramps, breast tenderness stopped. I am feeling well and I can't feel this baby's movement, suddenly it stopped. So this kind of complaint mother will give you. So what are the features of those missed abortions that differentiating from threatened abortion is that in both cases cervix was remain closed. That's why in both cases product of conception was inside the uterus. But if you check the uterus size, in case of threatened abortion, it was equal to period of gestation. But in case of missed abortion, it is smaller than gestation, as because fetus is died. And the USG finding is the conclusive sign. Here you will get fetus alive in case of threatened abortion, but in case of missed abortion, fetus died. As fetus is died, there will be no heartbeat present. Now, what is the management? And if a mother came with missed abortion, which kind of complaints she will give to you? She will say like, पहले मुझे वोमिटिंग, चक्कर, ब्रेस्ट पेन सब था, ओके, अब कुछ दिनों से प्रेगनेंसी का सारा सिम्टम्स खत्म हो गए हैं, कभी कभी हल्का ब्राउन डिस्चार्ज होते हैं एंड आई कांट फील बेबीज मूवमेंट. So this kind of complaint mother will give to you in case of missed abortions. Remember. Now what is the management of this missed abortion? As there is fetus dies, so you will confirm it with USG. Confirm with USG. Then what is your next important role? Psychological support. Okay, you don't know how much mental stress a mother will get once she get to know that her fetus died and she can't continue this pregnancy. So psychological support is important role for you as a nursing officer. Then you will do medical evacuation by giving mifepristone, misoprostol. Okay, or if fetus is still remain inside the uterus, you will do surgical evacuation by doing dilation and curettage or by doing suction evacuation. Okay, so that's all about your missed abortions. How will you differentiate between missed abortion and threatened abortion? In both cases, you see bleeding was absent, pain was absent, cervix was closed. That's why no product of conception was come out in both cases. So you can't differentiate by checking those features. Now how will you differentiate between those? By directly doing the USG. If you do USG, you will see fetus is alive in case of threatened abortion, but in case of missed abortion, fetus dies. That's why no active heartbeat present in case of missed abortions. Okay, that's all about your missed abortion. Now coming to the inevitable abortions. Okay, we will discuss now this inevitable abortion. Now what is inevitable abortions? Coming to the definitions of inevitable abortion. Here in this case, abortion is unavoidable. Okay, because why? Because I'm saying it is unavoidable. ऐसा क्या हो गया? Because it is unavoidable as because cervix is open with active bleeding. There will be profuse bleeding. Okay, lot of bleeding will be there along with severe pain. Okay, so what is the definitions of this inevitable abortion is that जब सर्विक्स खुल जाता है और ब्लीडिंग और दर्द के साथ एबॉर्शन रोकना नामुमकिन होता है, ठीक है। सो इन केस ऑफ इनएविटेबल एबॉर्शन, the abortion is unavoidable. Why abortion is unavoidable? Because continuous active bleeding होते ही जा रहे हैं and severe pain, that much amount of pain that mother can't stand properly. Okay, so this is the definitions of inevitable abortion. Coming to the key feature about this bleeding status, what kind of bleeding will be there? There will be heavy bleeding. Did you see those kind of bleeding in previous two abortion? No. In previous two abortion there was mild bleeding or either absent, but in case of inevitable abortion there will be heavy bleeding. What about the pain status? Here pain will be severe pain or cramps will be there. Okay, did you see those kind of pain in previous two abortion? No, the pain was absent or mild in case of previous two abortion, but in case of inevitable abortion it was severe pain or cramps will be present. Now if you do pervaginal examinations, here also another one unique feature, that if you do pervaginal examination you will see cervix is open. Did you see this cervix opens in previous two abortion? No, in previous two abortion cervix was closed. Here also it was closed, but did you see here the cervix, it gets open. Okay, so if its cervix is open but no product of conception will be coming out, here also product of conception will be inside the uterus. Although cervix is gets open, but product of conception will be remain inside the uterus. Why I'm saying, I will tell you one by one. Again I will say that uterus size, you will think that as fetus died, so uterus size will be smaller than gestation, but I will say no, it will be corresponds to gestational age. Why I'm saying, why you will say ki why ma'am, why it is corresponds to gestational age? You already said fetus already died, then uterus should be smaller than gestation, right? But I will say no, it will be correspond to the gestational age. Why? Because do you think a mother will be having active bleeding, a mother will be having severe pain, still she will be waiting home for 3-4 days, after that she will come to hospital? No, this inevitable abortion is a sudden incident. Once it arises, mother will directly come to you, because the amount of pain she will be having, she has to come directly to the hospital. The amount of bleeding she will be having, she can't manage it in home, so she has to come to hospital. And on the same day, do you think the uterus size will be decreased and it will be smaller than gestational age? No, it will be correspond to gestational age. Then once the management will be started, then slowly it will decrease, the uterus size will get decreased. Okay, now as per, you have to remember uterus size will be correspond to gestational age. Although cervix remains open, gets open, but still product of conception will be inside the uterus. It is ready to come out, but still it is remain inside the uterus. You have to remember. What about those features of this what about this USG findings? In USG findings it will say fetus died. If fetus died, there will be absent of heartbeat. Okay, absent of heartbeat. Okay, that's all about your inevitable abortion. So what you learn from this inevitable abortion? Inevitable abortion means in case of inevitable abortion, cervix खुल जाता है, cervix gets open, cervix खुल जाता है, and that's why there will be active bleeding, heavy bleeding, profuse bleeding will be there, and मदर को बहुत ज़्यादा दर्द होगा. दर्द के साथ एबॉर्शन को रोकना नामुमकिन होता है इन केस ऑफ इनएविटेबल एबॉर्शन. देयर विल बी हेवी ब्लीडिंग, देयर विल बी सीवियर पेन, cervix will remain open, although cervix remain open, but product of conception will be remain inside the uterus, and the uterus size will be correspond to gestational age, and in USG finding you will see fetus died, no active heartbeat will be present. Now if a mother came with inevitable abortion, which kind of complaint she will give to you? She will say that नर्सिंग ऑफिसर मुझे बहुत ज़्यादा ब्लीडिंग हो रही है, पेट में तेज दर्द है, लगता है और मैं बच्चा का मूवमेंट फील नहीं कर पा रही हूँ. दिस काइंड ऑफ कंप्लेंट्स मदर विल गिव यू कि आई हैव लॉट ऑफ पेन, आई हैव severe bleeding and I can't feel baby's movement suddenly. So this kind of complaint mother will give to you. What kind of management you will give? See, as there is lot of bleeding, mother can go into shock. So immediately you have to admit to hospital. You need to get admitted to the hospital. Then you have to start IV fluids to maintain the fluid status, or you need to do blood transfusions if it is necessary. Otherwise mother will go into shock. Okay, prevent shock. Then you need to do this medical evacuation by giving mifeprostone and misoprostol, or by doing surgical evacuation like dilation curettage. Okay, if it's necessary, you need to give antibiotics because infection chance is there, and obviously you need to give analgesics as there is lot of pain. So that is the management of inevitable abortions. Now so what different features you get here which was absent in this threatened abortion and in missed abortions? So the feature was, here it was heavy bleeding, and previous two abortion it was absent bleeding. Here it was severe pain, but in previous two cases it was minor pain or absent. And cervix, what about this pervaginal examination result? In previous two abortion it was remain closed, but in this case it gets open. Okay, so that's the unique feature you get here. Now coming to this incomplete abortion. Coming to this definition, what is the definitions of this incomplete abortion? Now incomplete abortion definition is some product of conception expelled. What about remaining? Some remain inside uterus. Inside uterus. Okay, कुछ हिस्सा बाहर निकलते हैं, बाकी यूटेरस के अंदर रह जाते हैं. This is the definition of incomplete abortion. What about this complete abortions? I will complete this complete and incomplete abortion together because this is quite common and like you can understand in an easy way this incomplete and complete abortions. If in case of incomplete, in the name itself it is saying incompletely some product of conception expelled, some remain inside the uterus. What about this complete abortion? Complete abortion में all product of conception expelled. If all product of conception expelled, then uterus become empty. Okay, so what is the definition of complete abortion? सारा प्रोडक्ट बाहर निकल जाते हैं, यूटेरस पूरी तरह से खाली हो जाता है. That is the definitions of your complete abortions. Now again, so what is the key feature of incomplete abortions? So as some product of conception still remain inside the uterus, do you think bleeding will be there? Obviously bleeding will be there, and that bleeding will be profuse bleeding. Profuse and prolonged bleeding will be there. Okay, because your uterus is trying to get empty, and until it gets empty, profuse bleeding, prolonged bleeding will be there as few product of conception still remain inside the uterus. What about this complete abortion? As all product of conception came out, there will be stopped. Bleeding will get stopped. Okay, previously bleeding was there. When this all product of conception expelled, bleeding also stopped. What about the pain? Here in case of incomplete abortion, okay, incomplete abortion, pain was severe. Severe camp was there, same like inevitable abortion. But what about the case of complete abortion? Pain gets stopped. Once the product of conception came out, pain also stopped as soon. Okay. Now what about this cervix? As some product of conception expelled and some remain inside the uterus, your uterus will try to expel the remaining product of conception. That is why cervix will still remain open so that the remaining product will come out. Okay, so in case of incomplete abortion, cervix will remain open, but in case of complete abortion, whole product of conception came out. Now it's not necessary for cervix to remain open. So once this product of conception came out, cervix will remain gets closed. Okay, so that is the thing. So again I'm saying, in case of closed cervix, where you saw in case of threatened abortion, you saw in case of missed abortion, you saw in case of complete abortion. where it remains open in case of incomplete abortion, in case of inevitable abortion. In these two cases, cervix was remain open. Okay. Now again, this uterus size. Do you think in case of incomplete abortions, what will be the uterus size? So uterus size will be smaller than gestational age. Why? Because fetus dies, some product of conception came out, so obviously it will be smaller than gestation, as there will be no further growth. What about the case of complete abortions? Your cervix will be small, well contracted, because full product of conception came out. And if you do USG, you will see that your uterus is empty. Okay. Now product of conception. Product of conception in both cases will be come out. Okay. Come out. Here also in case of complete abortion, come out. But it will come incompletely. But here it will come completely. So how nicely this features is describing one upon other, that you can easily differentiate this incomplete abortion and complete abortions, right? Now, if you do USG, then you will see inside this uterus still some fetus died, no doubt. Fetus died, and few portion of fetus absent and few present. But here in case of complete abortion, whole uterus is emptied. So that is the feature of incomplete abortion and complete abortions. Again we will discuss. In case of incomplete abortion, what's happen, कुछ हिस्सा बाहर निकलते हैं, बाकी यूटेरस के अंदर रह जाते हैं, ठीक है. इन केस ऑफ कंप्लीट एबॉर्शन सारा प्रोडक्ट्स बाहर निकल जाते हैं, यूटेरस पूरी तरह से खाली हो जाते हैं. This is the definition of complete abortion. Now, as कुछ portion still remain inside the uterus, that's why still bleeding will be continue, active bleeding will be there, profuse bleeding will be there. But in case of complete abortion, full product of conception came out, so bleeding will get stopped. In case of incomplete abortion, pain will still remain and the nature of pain will be severe. But in case of complete abortion, as full product of conception came out, so pain will get stopped. Now cervix, as few product of conception still remain inside the uterus will try to expel those remaining product. That's why cervix will still remain open. But in case of complete abortion, as all product of conception came out, so your cervix will automatically get closed. What about the uterus size? It will be smaller than gestation, and here also small, well contracted and emptied because all product of conception came out. And in both cases product of conception came out. In case of incomplete abortions, incompletely came out. In case of complete abortion, completely came out. Okay. And this USG finding, you will say fetus died in case of incomplete abortion. Few portions of fetus you can see in USG, remaining will be absent as because those expelled out. And in case of complete abortions, again your uterus will be fully emptied. Now again, what is the management? Management of this incomplete abortion. Management will be, in case of incomplete abortion, stabilize mother vitals with IV fluids, blood transfusion, okay. Then evacuation of uterus by doing dilation, curettage, okay, or suction. You need to give antibiotics to prevent infections. You need to give analgesics as severe pains are there, okay. And you need to check the vitals, and you need to monitor the vitals. What about the management of complete abortions? No active treatment is needed. No active treatment needed, as because all product of conception automatically came out. Confirm empty uterus by doing USG. Okay. You need to do observation, continuous observations with reassurance. Okay. You need to give antibiotics if needed to prevent infection. Okay. if needed or required, and obviously you need to give psychological support. So that's all about your all kind of abortions. Okay, so this is your full features of threatened abortion, missed abortion, inevitable abortion, incomplete abortion, complete abortion. Now again I will be discussing something. Let's think, if a mother came to you, okay, if a mother came to you, and by giving another examples, like if a mother came to you with complaints of any kind of abortions, you don't know which kind of abortions mother is having. So what will be your first question? What will be your first questions? That ask the mother whether this product of conception came out or not. Came out. Okay. So what mother will give you as an answer? Either she will answer either she will answer yes, or else she will answer no. Sorry. If either she will answer yes, or else she will answer no. If she will answer yes, then what can be the possibility? If it is yes, then it can be incomplete abortion, or it can be complete abortion, because only in these two cases product of conception was present. Again we will check here. See, in case of threatened abortion, product of conception was inside the uterus. In case of missed abortion, product of conception was inside the uterus. In case of inevitable abortion, although cervix was open, but product of conception was inside the uterus. What about incomplete and complete abortion? Products of conception come out incompletely. In case of complete abortion, product of conception come out completely. So if a mother says yes, there was product of conception come out, then you will think about either it will be a case of incomplete abortion, or either it will be a case of complete abortion. Now easily you can differentiate incomplete abortion and complete abortions. Bleeding will be, now how will you differentiate between this incomplete and complete? You will ask the mother whether bleeding is present. Mother will say yes, profuse bleeding is there in case of incomplete abortion. But in case of complete abortion, as all product of conception came out, mother will say no, bleeding stopped. Previously bleeding was there, now it gets stopped. What about the pain? Mother will say in case of incomplete abortion, oh, I have severe pain. But in case of complete abortion, once the product of conception came out, mother will complain bleeding was there previously. After one big tissue came out, bleeding gets stopped. Okay, this kind of complaint mother will give to you. You will check the USG. USG, you will say few product of conception still present, and remaining absent. Remaining absent means remaining expelled out. But here in USG, uterus will be emptied. Okay, so that's the way you will differentiate between incomplete abortion and your complete abortion. Now coming to this no answer. If you will ask product of conception came out, and if mother will answer no product of conception came out, then it can be a case of it can be a case of threatened, it can be a case of missed abortion, it can be a case of inevitable abortion. Because in these three cases you saw that product of conception was inside the uterus. So how will you differentiate between these three abortions? You will do per-vaginal examinations. If you do per-vaginal examinations, you will easily differentiate that in case of threatened abortion, cervix was closed cervix. Missed abortion also, it was closed cervix. But in case of inevitable abortion, it was open cervix. You can eliminate these inevitable abortions. Okay. Now how will you differentiate whether it is a case of threatened abortions or missed abortions? By doing USG. If you do USG, you will see fetus alive in case of threatened abortion, but in case of missed abortion, fetus died. As fetus died, there will be absence of heartbeat, but in case of threatened abortion, as fetus still alive, so heartbeat will be present, and like this way you will differentiate all abortion one by one. So that's all for today's topic of discussion. In next part, I am thinking I will be covering or solving question answer sessions. I will be taking one question answer sessions to check your knowledge whether you understand the concept of abortions or not. So thank you, dear student.